Hello, everyone, and welcome to WVU Medicine Children's Chats. Thanks for joining us. I'm your host, Catherine Vey. With February being Heart Month, it's only fitting that we spotlight the WVU Medicine Children's Heart Center. And joining us today, we have Dr. Nita Ray Chauduri, who is the director of the Fetal Heart Program and Cardiac MRI and CT Program. Welcome.
Thank you very much. Thank you for having me here.
Thank you for joining us. So first, I want our listeners to get to know a little bit about you. Tell everyone a little bit about you and how you came to us at WVU Medicine Children's.
Right. So I joined WVU Medicine Children's right after my fellowship, actually. So 7 years ago, and I'm still here. So I've had a great time, I would say, throughout during my stay here. I came with my family. I had a young child, 18 months old. She's grown. She's 8 years old now, and we absolutely love it here. So, and it's been great to have the support of everyone around here too during my time.
Well, we're happy to have you.
Thank you.
Talk to us a little bit about the Fetal Heart Program. This is a very specialized level of care, and it's fairly new. I mean, you said it was about 4 years old. That's not a very long time. So why bring this to WVU Medicine Children's?
Yeah, so, you're absolutely right. It is fairly new. Not that we didn't do fetal echocardiograms prior to implementing the program 4 years ago. But, when I started the program 4 years ago, I felt like I wanted to consolidate the process to have more specialized providers providing that care. It was very important, I feel, to start that program, not just for our heart center, but also for the state of West Virginia. So we are the only program right now, the only fetal heart program here in West Virginia. It's been amazing to see over the last 4 years how much we've grown and how much we're thriving, I would say. And also, not just, the program has not just been great, like I said, providing care within the heart center, but also has helped us collaborate with other teams around us that provide care to these patients. So has definitely strengthened those collaborations more and more. And also, increasingly over the last few years, we've seen how much it has improved our outcomes, and the delivery of care to these patients.
So how common is it for a baby to be diagnosed with a heart condition before they're even born?
Okay, so, heart conditions or otherwise congenital heart defects make up about 1% of all defects. And amongst those 1%, about 25% of defects are complex critical congenital heart defects. So it becomes very important to diagnose, to pick those up early. And, if we pick those up early, we can actually give the patients the care they need and implement care right after birth. And the team that actually helps us pick these patients up early are our OB colleagues, basically. So they'll refer a group of patients to us that usually will have non-cardiac, other associations that can be associated with cardiac defects, so often, or an abnormal genetic test. So when those patients are referred to us, usually those patients have heart defects that are picked up earlier. Now, interestingly, there's this other group of patients who have heart defects, but don't necessarily have, an abnormal genetic test or other non-cardiac conditions. So in those cases, it becomes crucial for the OB providers to actually pick up heart defects on that OB ultrasound. So they may see it partially or completely and then refer to us for a more complete evaluation. So when we look at it, like since 2013, there have been certain cardiac views that have the standard views that have been introduced into the OB ultrasound protocol. And with the advent of those views, we have seen that, over the last decade, I would say, and this has been proven by many studies, that we have greatly increased the detection of prenatal heart disease, so prior to birth, basically.
So for a mom, when they're pregnant, there's a lot of things to worry about anyway, but then you're at a regular appointment and they say to you, we want to refer you to the WVU Medicine Children's Fetal Heart Program that can add an extra level of worry.
Absolutely.
So when a parent comes to see you and they're referred to you, take us through that process. How do you sort of help them get adjusted and guide them through their care?
Yeah, so for their first appointment, so that's your question, right? So for their first appointment, basically they'll come in, so they'll be referred, usually the first thing they'll have is they'll get a fetal echo performed by one of our sonographers who are highly skilled at it. And then after the fetal echo, they are moved to a room where we start the counseling process. And so if a heart defect is detected, we will explain the heart defect in details and really break it down so that patients and their families can understand. So it'll be with the help of diagrams, we'll even draw diagrams out for them to understand. So not just the defect itself, especially if it's a complex defect, we'll also go through the procedures and interventions that the baby may need. And again, details of that. And we understand that, it is hard to take all of that information all at once at the first appointment. So if they have a complex congenital heart defect that's been diagnosed, we usually do about 3 to 4 appointments. So they'll have subsequent appointments where they'll come back and they'll have the opportunity to discuss more with you. We also provide them resources from different websites that are available that, and we actually have developed handouts as well for each of our heart defects. So they, patients and their families will actually usually receive a lot of information. And they are well informed, at least from all the feedback and from all the families that we've been seeing after birth. It's great to see that they felt that they were very well prepared for after birth. So in the process, of course, again, if it's a complex defect, we'll include the cardiac surgery team. They will do a separate consultation with the family. They will talk about details of the surgical procedures and treatments and anything that may be offered, down the line. We also involve our social worker. So what she does is she comes in, she'll provide them with resources that'll help them navigate their time, while their baby is being cared for in the hospital. Depending on the defect, if it's a very complex defect, we'll also include supportive care in the whole process as well. So that helps a lot of families navigate their time, and while they're caring for their baby prior to birth and then after birth as well. And then to also ease the process, we give them a tour of the hospital. So they get a tour of the birthing center, they get a tour of the pediatric cardiac ICU, they get a tour of the neonatal ICU, so all of the places where their baby possibly may be in the hospital.
There's power in knowledge, right? So just, making them feel comfortable and really involving them in the care process. It's not just, here's this diagnosis, we'll see you at the next appointment.
Exactly.
Your team really takes time with them.
Yes, absolutely. Yeah.
So obviously every cardiac defect is different and anything you could diagnose could be different. But what are some of the different, treatment options? Is it something that is treated in some cases before a child is born, or are there some cases where you have to wait until after a child is born?
Yeah, so for the most part, for most defects that we diagnose prenatally, so prior to birth, they may range from simple defects to the more complex defects. For simple defects, mostly it's monitoring, and even after birth, we'll monitor and follow them in our outpatient clinic. For the more complex defects, so often there will be probably, they'll involve decreased flow to the lungs or decreased blood flow to the head and the rest of the body. So for that, we can usually wait till birth. And we prefer to, for the most part, because we want that baby to be term and for all the organs around the heart to mature to a level where they're able to withstand the stress of if they're going to get surgery after birth, if they're going to get a particular intervention in the cath lab. And the immediate treatment that we can usually provide to these patients is start them on a medication to help maintain blood flow through these vessels while we plan for procedures. And all of this will be after birth.
So even, when people might hear that and they say, why wait till the baby's born? It's actually better. And I mean, you guys are monitoring them every step of the way. It's not just that the team is just waiting to see. I mean, you guys have a very detailed plan.
Absolutely. Yeah. Completely agree. Yeah.
So I'd imagine too, every step of the process, it might be different for mom and dad. There might be a lot of things changing, things like that. Like, how often during pregnancy or until a baby is born are you in contact with mom and dad? Are they able, if they have questions, to reach out to you anytime, or not just at appointments?
Yeah, so, the appointment, of course, will be the main point of contact, but in between, they'll either call us, or they actually send questions through their chart to us. So sometimes they'll still have, obviously, we've given them all this information at their appointment, and then, they go home, think through it, or read things off the internet, or wherever they're trying to look up information, or even based off the handouts and the information that we've given them. So they'll come up, a lot of the times we've had that too, they'll come up with several other questions when they've actually had time to sit and think about it. And then, what I'll do is I'll look at all those questions, give them a call, go through each of those questions, and hopefully help to clarify, a lot of the thoughts that are crossing through their minds.
When you talk about all these different types of conditions, is there one that's more common than the other? Are there more common types that you see, or is it really a wide range?
Yeah, I would say overall wide range. So ranges from very simple defects to simple defects, in terms of, if I want to explain it really simply, the simple defects will be more like what we call holes in the heart, versus we'll have the more complex defects, like I was explaining earlier, where you'll have decreased blood flow either to the lungs or to the head and the rest of the body. Then those become more critical. And that's really the other spectrum of defects that we see.
At the WVU Medicine Children's Heart Center, I know we always talk about the team sees patients from before they're born and into adulthood. I mean, even after a baby is born and hopefully that defect is treated, you're still seeing these patients for follow-up sort of as they grow. It's almost like they never leave our team.
Yes, I know. And I feel like overall it's an amazing experience. I've been here, now a total of 7 years, I would say. And yes, I've seen a lot of those patients now grow, go to school, college. It's an amazing experience. I would say absolutely thrilling to see them do all of that.
Other than, sort of the emotional benefits that make you smile, mom and dad smile to see these kids thriving as they grow, what's the benefit of having them with the same team of providers their whole lives? There has to be a benefit. Everybody's familiar with their condition.
Yeah, I think a lot of it has to do with familiarity. Though, it provides, I would say, good continuity of care for the families, patients and their families. A lot of the times I feel more for the patients. They feel more comfortable if they stay on with you throughout. Once they get used to you, they want to stay on. But, if let's say, if we're in the situation where a provider leaves or something, we always, another provider will step in from the team, and we've seen that has still worked out amazing. So, overall, yes, they love to stay with the same provider. But at times when, there is a transition period that also happens, especially when they move on to adulthood. And so during that time, they will move on to a different provider. So sometimes that transition can be difficult as well because they want to stay on with you. So we usually start transitioning them around that kind of teenage years, 15, 16 years onward. So I start having the conversation so that years down the line when they're actually 18 years old and ready to move on, that they're actually ready. I have patients like that just want to stay on forever. Yeah.
We talk a lot about, the importance of pediatric care in West Virginia and how WVU Medicine Children's fits into that. But this is an extra, like, highly specialized level of care. How important is that for people in the state to be able to have that here? They don't have to go out of state. They can stay fairly close to home. How important is that to you to provide that to West Virginia and really the surrounding region?
Yeah, I think, like I said, and I think we spoke about this earlier, since we implemented the program 4 years ago, what we have seen is not only has it been important to have this program within the Heart Center, but it has greatly been important to have it within the state of West Virginia. And the fact that we can provide this care, locally for our patients has been amazing. And it has been amazing to see over the last 4 years since we started the program, how much the program has grown. I can't wait to see how much more. It continues to grow. It's thriving. It has definitely helped, even within the hospital itself. It has helped to strengthen our bonds and collaboration with other teams who provide care to these patients as well. And overall, we've seen great outcomes in care as well, just being way more well informed. I would say, not just for physicians and the team, but also for patients and their families. So it just helping them be more comfortable in the whole process.
You mentioned that collaboration of care. I mean, WVU Medicine Children's really is sort of the collaborative hub. If a child maybe needs treatment from the Heart Center, but also another program within the hospital, they don't have to leave and go somewhere else.
Exactly.
And you're able to all work together. I mean, that's such a powerful thing, not only for health, but also for, peace of mind for parents. They don't have to drive their kid all over the state. It's a quality of life thing.
Yeah. And a lot of the times what we do is we try to make sure that their appointments are lined up on the same day. And, when I say a lot of the times, actually all the time, that's what we try to do, especially when they're driving from far away. So we line up their OB appointments, their fetal heart appointment. If they have any other appointments, we make sure that they don't have to come back again and again to the same place. So.
You said you can't wait to see what the future holds. What do you hope it holds for this program? What's the vision?
So the vision, definitely waiting to see how much more it grows. That's one thing. We are continuously adding clinics, which makes me very happy to see, which tells me that the program is just growing, at a very fast rate. And then the other thing that I see coming up in the future is we're working on building a fetal cardiac MRI program as well, with the hope that fetal cardiac MRI will help complement a lot of the imaging that we do with fetal echo. So just help in kind of, detailing out some more details out of those complex heart defects so that we are more informed prior to birth. And so, looking forward to that. So that's still upcoming. It's been around, I would say, for the last 2 to 3 years nationwide. And at WVU, we started the program this year. That's coming up. So I would love to see how that, brings us just that step closer to a more accurate diagnosis.
You're going to be healing more hearts of our tiniest patients here at WVU Medicine Children's.
Yeah, thank you.
That's what we like to hear. Happy, healthy hearts.
Thank you very much for having me today.
Thank you so much for coming, Dr. Chauduri. It's been a pleasure to learn more about the program.
Thank you.
Thank you all for joining us today. Now, if you want to learn more about WVU Medicine Children's or the Fetal Heart Program, you can always go over to our website, WVUkids.com. I'm Catherine Vey, and for all of us here at WVU Medicine Children's, we'll see you next time.